next speaker, who is Brent Hisaka. Brent is a physical therapist here at UCSF Benioff Children's Hospital. And let me just see if I can get the slide up, Brent. Sorry, there he is.
No problem.
Okay. And so Brent, as I said, he's the lead physical therapist for our pediatric limb and complex reconstruction center. He's mostly at our Walnut Creek campus, and he also takes care of athletes. So Brent's going to talk to us about the role of physical therapy or physiotherapy in limb lengthening in children. Thank you.
So my name's Brent. I work primarily in an outpatient setting, actually exclusively in an outpatient setting. I actually work in our sports medicine center. So it makes a lot of these cases really rewarding. I'm seeing these patients go from, after their first surgery all the way till they're, reaching their desired level of function, which for a lot of these patients is a pretty high level. Let's see, it is not, there we go. No disclosures from me for today. Things I want to talk about. I want to talk about what do we do, briefly describe some of the rehab processes for a few of these types of surgeries that we see in our clinic, and then talk about some of the team building aspects, keys, important things to note, and areas where we can maybe be improved. So the big thing is, as we've seen today, it's not just one procedure. Having a limb reconstruction practice involves a lot of different possible procedures. And so one of the things that's important as a physical therapist is understanding where things are similar and where things are different, and how to approach those different types of cases. With that in mind, a lot of these cases, if not all of them, have really similar goals. So we're always trying to reduce pain. We're always protecting the surgical site from injury and infection. We're trying to restore range of motion, improve strength, and really we're trying to maximize the patient's function from whatever procedure they've had and whatever it is that they want to do. We're always trying to meet patient-specific goals. And of course, one of the most important things, if not the most important thing, is helping educate the patient and family on what they should be doing and what the process is going to be like. As physical therapists, in our clinic, we will see these patients at least 2 times a week, if not more. So we are really seeing these people a lot. We may see them more than anyone else. And so having that point of contact where we can answer questions or direct them where they can get their questions if we can't answer them directly is really important. So I want to talk about a few of the procedures that we see. In my setting, the vast majority of the patients that I see are undergoing either some sort of limb lengthening or an epiphysiodesis to either correct angular deformity or halt growth even. So for lengthening of the femur tibia, like I showed in the images earlier, the way that we're going to do that is typically either with a magnetic intramedullary nail or with an external fixator. So during the lengthening phase, we're really looking at, maintaining and achieving important ranges of motion. So ankle dorsiflexion, knee extension and flexion, hip abduction. We're trying to set them up for success when they transition into weight bearing later in the consolidation phase, and make sure that we're avoiding any of the serious complications of having a knee flexion contracture or a knee extension contracture. These patients that may have a congenital lack of ACL, you really need to get full knee extension to avoid issues later on. And similarly, as those muscles tighten up during lengthening, we want to ensure that we're maintaining range of motion. Like I said, we're managing pain. If you have an external fixator, you're going to be at risk for those superficial skin infections at the pin sites. So we're monitoring that, and we're being mindful of other signs of issues like nerve injury. During that consolidation phase, we're progressing to full range of motion. We're progressing their weight bearing. We get to start to get into gait training, more complex strengthening. Like I said, I work in the sports medicine center, so a lot of these patients maybe want to get back to sports, working out in the gym. So we're starting to initiate things like squats, lunges, progressing the stairs. And of course, all of those other things like pain management and infection control are ongoing until we have devices removed. One of the things that you may also see as a physical therapist, as we've talked about a lot today, is amputation. So we're going to be involved in the early aftercare, checking wounds, helping with stump shaping and edema control, education on position. Again, we're trying to avoid those complications during these early stages, especially while things are really sensitive. And then again, we get into our bread and butter as physical therapists. We're working on strengthening. Even before they receive their prosthesis, you can work on hip strengthening, you can work on mobility. And then once they receive their prosthesis, of course, we're working on gait, strengthening, functional tasks, ultimately moving into sports or whatever it is that they want to do. And of course, one of the most important things, like I said, is education, is a home exercise program. We're making sure that they know what they should be doing at home. That's both the patient and the family. A lot of our patients are really young. They may need help from parents for stretching, positioning, things like that. So it's really a team process, not only with the medical team, but with the team being the whole family, caregivers, things like that. Communication from the team building perspective is number one. It's the most important thing. Dr. Parihar showed all of the people that could be involved in a team, and all of those people need to be in communication with each other, be able to talk to each other, especially because one of the things that he mentioned that I thought was a really great point is that everyone starts at a different place in terms of how long they've been doing this, what is their expertise on different procedures, things like that. You as a physical therapist, you maybe only get 1 or 2 of these patients a month or every 6 months or a year. And part of giving those patients the best care, as well as developing yourself as a physical therapist, is to communicate with the doctors so they can help you understand, what do these patients need? How can you do better? How can we help them the best? And subsequently, the reverse of you letting the rest of the team know, how is this patient doing? What can we do better? What do they need? And all of that also ends up going through the patient and the family as well. I think big things to watch out for, obviously, is failure to do those things. If you're not communicating effectively with the team, not only does that lead the physician or the PA or the social worker to be potentially out of the loop on certain things, or for you to be out of the loop on certain things. But it also creates confusion for patient and family if they're getting mixed or different messages. And the most important thing, as always, is that the patient is satisfied, both not only with the outcome of their actual procedure, but with how they feel they're being treated and their understanding of the whole process. Especially as a physical therapist, things to watch out for is, don't pass the buck. There are things that maybe we don't do all the time in your practice. But if you can check a patient's wounds, if you can look at things that maybe they see the doctor in a couple days, that doesn't mean that you don't still check those things, because a lot can happen in a couple days, especially early on in this process. So make sure that you're just being on top of everything, and don't just say, oh, we're a part of a team, so let me just let the next person do it because they see them soon. I know that was pretty quick, but hopefully you were able to take something out of that. Like, the big thing to take away is work with your team. That's the most important. Thank you, everyone.